All right. Hello, everyone. Full disclosure, we are streaming live and also recording this event. We'll give everyone just a few more minutes to come in here. All right, let's get started. Hello and welcome to our Fireside chat discussion, the state of the data on child abuse and neglect. Thank you so much for joining us today, whether you're joining via streaming or here with us in the webinar. We're really happy to have you with us. My name is Tracy Flood. I'm the president of the board for the BroadStreet Institute and the CEO and co-founder of BroadStreet. I'm located just outside of Milwaukee today, and you see some other faces here. Joining me is Gopi, joining from Charlotte, North Carolina, and also Kalamakaleimahoehoe Porter, or Calais, joining from Kansas City. So let's give a wave. And I'm going to say that Manju and Calais have both been leaders on this particular data project. And I'm thrilled and honored to be sharing their work and the work of their team. We obviously want to start by giving a big thank you to Calais, Manju, and all of their team members. And we also want to thank our sponsors. This project is sponsored in part by Franciscan Health and also by the Victims of Violence Coalition. The Franciscan Alliance is a nonprofit health system with over a dozen facilities located in Northern Indiana and Illinois. We also really want to thank the Annie E. Casey Kids Count Data Center. As you will see, honestly, we cannot thank them enough because their amazing resource honestly helped us so much and was a huge asset as we started out this assessment. And if you haven't already checked out the Kids Count Data Center, we'll provide the link at the end of this session. All right, and of course, thank you everyone for joining us today. So a few logistics before we get started. First of all, as you can see, this event is being recorded and is also live streaming on several platforms. That means that the people in the Zoom room have access to the Q&A button if they have any questions. And those joining us from Facebook, LinkedIn, Twitter, YouTube, and Twitch, if you make comments, please know that those are unmanned, and we're happy to answer questions at the very end. We will share instructions with those who've registered for this webinar on how to access the recording later on. All right. The outline for today is basically, we essentially just want to discuss the methods and findings and the availability of good public data on child abuse and neglect in the United States. Before I do that, we'd like to learn a little bit more about you. Those of you in the webinar today will be sending around a poll. And then we want to share some background on BroadStreet and the team. Who are we and why do we care about good public data? We also want to spend some time defining what we mean by good data. It might mean something different for everyone, but we're happy to share our 3 criteria on what it means to us. All right, so first we want to take just a little moment and learn a little bit more about you, because this is a casual fireside chat style discussion with very few slides and maximum customizability. And so in order to do that, we're going to be sharing a poll. Those of you who are joining us on other platforms, you will not be seeing this poll as it is only for those who are in Zoom. All right, I'll be launching the poll now. All right, so those who are joining us on other platforms, feel free to answer these questions in the chat. Those of you who are joining us today on Zoom, I will read the questions aloud as you can feel free to answer them at your leisure. So what we really obviously love to talk about around here is data, and we really want to know about you. So how often do you work with data? Please pick the best option. Are you a professional data person, a data scientist, epidemiologist, a database manager, consultant, statistician, researcher, etc.? Some people really do identify as data people. Some may not work with data very often, but are curious. Feel free to let us know if that describes you. And then also, if you maybe manage or oversee other members of a team that work with data, that's one other option. All right, how do you like to use data? Please select all that apply for your professional career or whatever you're working on now. So for instance, do you use it to write grants? Do you use it to essentially target interventions and show evidence of need in a particular region? Are you a consultant or somebody who helps others, works with clients? Do you use it? Are you a funder who distributes and guides funding decisions based on data? Do you use it as an advocacy to raise awareness to the general public? And then finally, do you use data to evaluate the success of a program or initiative that you might be implementing? All right, and then this is a very honest question. We really want to know about your baseline familiarity. Before you signed up for this webinar, which had you heard of? NCANS, and we'll talk more about what the acronym is later on in the session. BroadStreet, that's us, and the Kids Count Data Center, which was in my thank yous just earlier. So we'll give everyone just a few minutes to finish the poll. Those of you who are joining live on YouTube, Facebook, LinkedIn, Twitter, please feel free to let us know in the comments and we'll review those later on. All right, we've got most of the votes in. I'm going to end the poll there and then show the results. All right, so how often do you work with data? It actually is a really great mix in this group, including the other option. So it looks like there's a pretty good mix with people that self-identify as a data person who might not work with data and who manage others directly who oversee data. All right, how would you use data? We have a majority of people working with clients, also to show evidence, to write grants. People are using data for all sorts of stuff, which is really fun. So distribute and guide funding, to raise awareness, to evaluate. That's really fun for us to learn how many other ways people are using data. And it looks like that there is familiarity with the Annie Casey Kids Count Data Center and also with BroadStreet, a little bit less familiar with NCANS there. All right, great. Oh, thanks everyone so much for helping us learn just a little bit more about you. So now it's kind of our turn. So who or what is BroadStreet? For those of you who are unfamiliar with BroadStreet, you might be wondering that. So the BroadStreet Institute is a nonprofit organization pending 501c3 tax-exempt status as of now. And it was founded by 3 co-founders who all met at an open data initiative, myself included. And I'll tell you that that open data initiative was held in an old abandoned mall in downtown Milwaukee, and that was several years ago. And we came together with this shared mission to ensure that everyone wanting to improve health in their community has access to the best information possible. We were realizing that there were a lot of data gaps and disparities, and we really wanted to be sure that everyone who was trying to improve health in their community had access to the best information possible. All right, the co-founders, we started by making maps, software, and assembling hundreds of indicators from dozens of public data sets. We really spent a lot of time looking at public data, as you might be able to tell from our roots. A core part of our belief is that assembling and sharing the data is really only the start. And it's really, really important for each and every one of us to train the next generation of leaders and advocates for good data. So pretty much 18 months ago or so, we began taking on interns and volunteers. For those of you keeping score, that was right in the middle of the pandemic. And that's essentially when the root of the BroadStreet Institute was born. So our team has grown from those 3 co-founders now into over 300 active volunteers on the project. We've had over 1,400 volunteers on this past 18 months. So I will say that volunteers are future leaders in the field of public health and data science, software engineering, medicine, environmental health, the biological sciences, and honestly, many other fields and backgrounds. Of course, what we all have in common is that we come together around the data and have a shared belief that good data can heal the world. Yes, we believe very strongly that good data can heal the world. We believe that at its best, it can guide, change, unify people, bridge divides, and ultimately empower true community change and moving the needle on health. So the team of 300 plus, we all come together to assess the availability of good data. We assemble data sets if they do not yet exist. And we like to share that information with downloadable data sets available to the public. Also, of course, we obviously still love maps and software and making sure that those are easily accessible to even the non-data person. And we also host events like this one. So for a sense of scale, in our network, we have tens of thousands of community change makers using the data around the United States for creating maps, running reports, and conducting research, which of course brings me to why do we care so much about good data? We obviously want to empower the efforts of these community change makers within our network. Many of those are using data for really awesome purposes. They tend to be nonprofit organizations working in very complex multi-stakeholder collaboratives and collective impact initiatives on really big challenges and long-term goals. The majority of these, like our funder, Franciscan Health, they work very locally, they invest locally, and they also span multiple states. And so of course, when we say multi-stakeholder collaboratives, we mean teams of people that come together to address really, really big challenges as a team. And of course, these can include things like donors and funders, leaders in public health, nonprofit organizations, both big and small, hospitals, healthcare providers, as well as payers, government agencies, researchers, politicians, and of course, community members and concerned citizens. So obviously you can see that this list includes many organizations beyond those that directly address child abuse and neglect. We obviously value the work of those working to address the issue of child abuse and neglect, but please know there are many others, and these multi-stakeholder collaboratives are here to help. We do believe that we are stronger together, and this is especially true if everyone has access to good data. So what do we mean by good data? I've used the term a couple of times. I'm going to say that we have 3 criteria that we determine whether or not data are good. So in our minds, at least, good data needs 3 things. First, it needs to exist in more than one place or region, and ideally has really good coverage. So for instance, data from one city can be informative, data from one state is amazing, but of course, data for all cities, states, and places in the United States is ideal. Second, data are shared in the public domain at a useful geography. By public domain, we mean that it is easily accessible and not locked away in a portal where only 2 people in the state have access. It also means that you do not need to sign a waiver and go into a dark password-protected room without a phone or a computer in order to see it. Yes, we have requested access to data sets that were like that. And ideally, of course, public domain would mean that it would be a downloadable data set, free and available online, or even by a queryable API. By useful geography, we really mean an actionable geography. So where should investments be made? Where are opportunities for evidence-based interventions to improve health? A useful geography can guide these important decisions. I would say that maybe state level data can be useful for some, but it might be a bit too large scale for others. And so a useful geography in many cases is below the state level. I would propose at the county level or even lower. So you might be thinking that releasing data to the public about individual child abuse and neglect cases might be a violation of privacy for the family. You'll be relieved to know that case level data are often not needed to take meaningful action, at least not for coalition members who are looking at it from a population perspective. Often county level rates or any type of aggregated data can be useful. So we obviously support the conversion of individual case level data into aggregated rates for a region, a county, for instance, rolling averages over time. These aggregations can create useful geographies for the shared public data file. Finally, the third criteria that we have is that comparisons and benchmarks can be made. This obviously plays into coverage, but also it sometimes required shared definitions of variables and indicators. It's ideal if comparisons can be made across state lines and national benchmarks can be calculated. All right, so those are our criteria. 1, data has good coverage. 2, data are shared in the public domain at a useful geography. And 3, benchmarks can be calculated for comparisons. All right, so of course, we sought to figure out if data on child abuse and neglect measured up to these 3 criteria. Our project began several months ago with a team of volunteers and assessment of data availability on child abuse and neglect. There's good news here. It turns out that all 50 states are submitting data to NCANS, NCANDS, the National Child Abuse and Neglect Data System. Whew, this was actually very great to hear. We were incredibly happy that data were going into NCANS, but the question was any data coming out? Any summary statistics or measures or aggregated data coming out, maybe at the county level? All right, so the answer was yes, there was some data coming out of NCANS, and at least those collecting it at the federal level were reporting it at the state level for all 50 states. Was it reported below the state level? That did depend on the state and the state's own reporting methodology. So this is where we thank the Kids Count Data Center because it gave us a really nice head start. It had already collected information on what states had state level data, county level data, or both. And where we were not able to find something on Kids Count, our team did do a deep dive into the data archives, going into the Wayback Machine, looking back in time, looking on different agencies' websites to try to see if we were missing something. And so we did that deep dive of following up from the Kids Count Data Center. All right, what did we find? So using awesome data from the Kids Count Data Center and our own sleuthing, we were able to pull together some different data sets from the different states, and we compared it to our 3 criteria for good data. Here's what we found. Criteria 1, did the data have good coverage? So obviously, yes, we are absolutely thrilled that all 50 states were submitting data to NCANS. This, if it's a voluntary system, it doesn't necessarily guarantee it's universal. We're really happy all 50 states are submitting. So this has really the potential to be a great data set, knowing that everything's going to a single unified database potentially. Okay, so data were going in, was it coming out? So criteria 2, were the data shared in the public domain at a useful geography? So let's start with the public domain and then we'll talk about the useful geography. All right, so public domain. It turns out that data were going into NCANS, but we weren't really sure what was coming out. Data at the state level was summarized very nicely in the Child Maltreatment Report by the U.S. Department of Health and Human Services, along with the Administration for Children and Families, Administration on Children, Youth and Families, and the Children's Bureau. All right, in addition to that federal state level reporting, some states also provided their own data below the state level. All right, so that brings me to, were the data in the public domain available at a useful geography? State level data may not be useful to everyone, so we were looking at county level data. It turns out that 41 of the 50 states were reporting data below the state level. 37 states reported data at the county level. 4 other states were sharing sub-state but non-county level data. So for instance, health districts. All right, criteria 3, could benchmarks be calculated? So this is actually where we ran into really big problems. Definition of what counts as child abuse and neglect really varied by state. So first of all, what counts as a case? What's something that's being reported? 3 states, Maryland, Oklahoma, and Massachusetts, only reported investigated cases. So for instance, we sent people to investigate 200 calls, 200 would be what they report. Okay, so New Hampshire, Missouri, and 16 other states reported only confirmed or substantiated cases. So for instance, after going to the house and investigating, there were 150 confirmed cases. Obviously, not all investigated cases end up as confirmed cases, so we counted this as 2 separate variables. All right, so that leaves 20 states who reported both investigated and substantiated cases. Thank you to those states who are reporting both. All right, in addition, we also found some definitional challenges in the sense that What constituted abuse and neglect also differed between the states. So for instance, prenatal substance exposure might be included in some states as child abuse. All right, and obviously we also found that county level data were shared at different times. Maybe the report came out a couple years ago, 10 years ago, just last year, and maybe includes different year ranges as well. All right, so the combined effect of all of this is that for public data, which means that data that the public can access, benchmarking and comparisons between states is going to be a little bit of a challenge. Luckily, we're up to that challenge. All right, so let's summarize here. The potential is there for a national unified data set with county level data reported. Criteria 1, coverage was theoretically excellent because data are collected from all 50 states. That's really good news and means there's great potential. Criteria 2, were the data shared in the public domain at a useful geography? Sometimes. So 74% of states, 41 out of the 50 reported data below the state level. Oh, I apologize. 74% report at the county level. And we believe that county level is a very useful geography. All right, criteria 3, could benchmarks be calculated across regions? This one is going to be a challenge. So of those reporting at the county level, definitions of what counted as child abuse and neglect varied quite a bit. And obviously so did the way it was aggregated and the years that were used. Okay, so as I mentioned before, there is potential for a national unified data set. What is available now really is at the mercy of state to state reporting. So what are the next steps here? What comes next? We actually believe around here that some data are better than no data at all. And with that in mind, we wholeheartedly thank the states reporting sub-state estimates, particularly at the county level. We also want to thank the NEKC Kids Count Data Center for bringing a lot of that information together. This assessment is really just the beginning. We are going to share our methods and attempt to create a unified national database. The reason for that is that enables things like mapping and graphs and reports and hopefully some research as well. So no, I'm going to say that this is not perfect or ideal, and we'll address those in our published methods, but we do believe it is a start. And we understand that public data is the byproduct of data being created and shared by others, people that are managing those cases, for instance. And I just want to emphasize that the public can do good things with that data. So we will continue to actively seek feedback, partner, and advocate towards this goal. Thank you so very much, and I will open the floor to questions. For the questions, I will be pausing the live streaming, so you do not have to feel shy or bashful when asking them.